Welcome everybody to the Journal of Physical Activity and Health's Author Corner. My name is Jay Maddock, and I am the director of the Center for Health and Nature here at Texas A&M University in Texas, United States of America. And today we have some international authors who have an upcoming paper in JPA entitled Nature-Based Early Childhood Education and Children's Physical Activity, Sedentary Behavior, Motor Competence, and Other Physical Activity or other physical health outcomes, a mixed method systematic review. Joining me is Dr. Ann Martin. She's a research fellow at the MRC CSO Social and Public Health Science Unit, Institute for Health and Wellbeing at the University of Glasgow. She's involved in developing and evaluating complex interventions for health improvement of children and young people with a focus on obesity prevention and mental health promotion. Also joining me is Dr. Paul McCrory. He is also a research fellow at the Institute for Health and Wellbeing at the University of Glasgow. His work primarily explores the built, natural, and social environment, determinants of health and well-being in children and young people, including physical activity levels and behaviors. Both Ann and Paul co-lead a program of research around the evaluation of the impact of outdoor and nature-based play and learning of health and well-being of children's families and communities. So welcome, we're delighted to have you today. Talk a little bit about your research. And so my first question is really around what is nature-based childhood education setting. So my son, we were growing up in Hawaii, and I would go and pick him up and he'd be on the top of a papaya tree. And that was certainly to me nature-based education, but probably not what you're finding in Scotland. So can you tell us a little bit about the range of environments and settings that you looked at in this review and what it means for nature-based early childhood ed?
Yeah, good question. So I'm going to start off and then Paul will mention a bit more about the different environmental features that exist across the globe, actually. So there is kind of a more or less fixed definition around what nature-based early childhood education is, and it's mainly characterized by integrating nature into the philosophy and design of education and play and care of young children. And children would typically spend most of their days outdoors engaging with natural elements, and it can be like trees or ponds or any water features, could be other types of vegetation or natural loose parts like sticks or stones or aspects like that. And across the group, there are different terminologies. So maybe forest kindergartens you have come across, or in Australia, they mention bush kindergartens or nature schools, or there are so many terminologies around it. But there is a big variation in terms of the approach taken, the exposure in terms of environment, but also the duration that children spend outdoors in nature. So also it's important to distinguish between outdoor childcare, because it can clearly be involve kind of a concrete jungle, so children can play and learn outdoors on a concrete surface or in a very urban environment without parks or natural features. And then as opposed to outdoor childcare is then also this subsection around nature-based childcare. But I let Paul elaborate a bit more on what's going on in Scotland, because we have quite a unique policy landscape when it comes to outdoor nature-based childcare.
Yeah, thanks, Anne. And yeah, Jay, I think you hit the nail on the head in terms of your own experience of where you and your son kind of grew up there. Scotland certainly does not have access to papaya trees, but they certainly have access to lots of other different kind of geographically distinct and culturally distinct kind of affordances that exist within the actual environment in which, you know, children can grow up in Scotland. And Anne mentioned there that we have a fairly unique policy landscape where, you know, it's a national policy priority for children to actually learn and play outdoors, and where possible in naturalized environments. And they can deliver ECE across a spectrum of models. And it's probably quite unique in Scotland that we have that one category of what would maybe classify as a more kind of extreme exposure to nature, where we have children who go to outdoor kindergartens or forest schools, perhaps 3, 4, 5 days during the week, and they are outdoors the whole time. They are perhaps under dense canopy in forests, and they have all amenities and facilities available to them in that space. So outdoor toilets, they have access perhaps to fire pits, perhaps water in terms of rivers or lakes. So all of their learning and play opportunities exist there. They'll use the naturalized kind of affordances that exist, whether it is the trees to climb, the trees to build, to hide, to play. They'll use all that. So one can imagine the actual exposure in that particular area and that delivery model compared to what perhaps is more traditional in our kind of school setting structure with our ECE, where we perhaps repurpose the traditional kind of standard structures of our kind of early years provision and utilize what outdoor space we perhaps already have. So one particular model that we talk about is called an indoor-outdoor model, where the actual infrastructure itself is set up to be child-led, and they themselves dictate where they want to be. And it will be up to the practitioners and educators to actually work with the children to see where they want to go. So that means actually the children are able to flow freely indoors or outdoors through doors that they themselves can open and close. It's free flow. So if they choose to be outdoors, they can so. And when in the outdoor space, they perhaps are repurposing loose parts or trying to naturalize those play spaces to afford opportunities that perhaps are close as possible to what we've maybe seen that more extreme version of outdoor nurseries. So that's one particular model that perhaps also reflects a bit of a dose component of that exposure aspect. One other thing that we talk about in Scotland as a delivery model is called satellite models. So particularly in urban and dense urban environments in the big cities, green space perhaps is hard to come by, or certainly naturalized land that the ECE settings perhaps don't have much access to. So again, we repurpose derelict land or naturalized green spaces that exist within the kind of urban landscape, and we use them as satellite settings. So children, they will be taken perhaps in a couple of days a week or in blocks of 1 week or 2 weeks. They are either walked or bused or transported somehow to that particular area, and they spend the whole day in that particular setting. Again, very much afforded from a kind of naturalized context as well. And Scotland, as I said, is a unique policy landscape, so they're trying their very best to ensure that children spend at least 50% of their time outdoors as well, and where they possibly can, it's across that spectrum of delivery. But as you said, geographically and culturally distinct, you can think about Scandinavia or North America, Australia, and you're going to see completely different environments, but utilising where possible and where culturally relevant the kind of naturalised affordances that exist. So whether it is beaches or it's the bush, perhaps also very much dependent on climate and what they can and can't do in those settings, but certainly use that unique localised understanding to ensure that children are delivered and provided with the best possible outdoor space.
Great. Well, thank you. That's fascinating. It sounds like such a wonderful environment for kids to learn in. So you guys have a new paper coming out, this really cool systematic review. So you can tell us a little bit about the main findings of what you found in your review.
Yeah, I kind of kick off again. So we, so after we had a look at the existing literature, and there were over 50 articles that we looked at, both quantitative and also qualitative studies. And then we identified that there are actually 3 distinct categories. So one was the actual nature-based early learning and childcare environment, but then there were also studies that looked specifically at what happens if you add natural elements. So when you naturalized or when you let children play and learn with natural elements. And the other one was, the other category was naturalizing playgrounds. So maybe more man-built playgrounds and then adding some natural elements to them, like trees or wooden aspects. And what we found, and I'm focusing on mainly on the physical activity outcomes here because that's for Jake, right? The interview. So we found that in in the nature-based settings, so where the philosophy and the learning is really embedded into the nature, that there is an association. We can't speak of causality. Paul will elaborate a bit more around the quality of studies, but there is a link between spending time in nature-based ECEs and having reduced sedentary time and better balance. So in terms of motor competence, so we looked at a few different motor competencies like object control or speed and agility, but only balance seems to be associated with improvements when spending time in nature-based childcare settings. In terms of MVPA, so moderate to vigorous physical activity intensity, there was a very conflicting and inconsistent finding. So some studies said, yes, there is benefit. Some said there we find nothing, or they even say, oh, this reduced, the MVPA is reduced. And I come back to that a little later because we wanted to understand a bit more why can there be a reduction in MVPA. So in terms of natural elements, so thinking of vegetation, there was also quite consistent positive association with different types of physical activity. So one was sedentary time was reduced again, but an increase in total physical activity, an increase in step counts, and also studies that used counts per minute as their outcome measure. So there was an increase in counts per minute when children engaged during childcare hours with natural elements. In terms of natural elements and MVPA, there was again a bit of a mixed, inconsistent finding. So half of the study, so 3 out of 6, they actually said that MVPA is decreased when the settings had like hilly landscapes or natural surfaces, or where the vegetation was quite dense. And again, it's quite interesting. Maybe some of the viewers can already come up with ideas why that might be, that the physical activity intensity is reduced when there is a lot of nature there. But as I said, we also looked at qualitative studies because we were quite interested in understanding how practitioners in early year setting make sense of their observations of young children in a naturalized or in a nature-based childcare setting. And then we use those quotes and themes that emerge from qualitative research and try to kind of explain potentially quantitative findings that we've seen. And what we can find there, that there are, it's all it's explorative, right? It's not proven because it's for future studies for future research to be done. It's just a couple of hypotheses that we, or pathways that we came up with based on the qualitative studies. So for example, why some studies found that there's an increase in MVPA, time spent in MVPA, and that could be because there is a different interaction between children and educators when they are outdoors. So educators might, the educators might encourage more physically intense play, but also the children might find the environment much more engaging and therefore engage in higher physical activity. And also nature and the natural environments has also a restorative effect. So that could also be an element of that the recovery periods are maybe longer or better, and therefore then the bouts of MVPA can be also longer or more frequent when children spend all day outdoors, for example. But then in terms of why could there be an lower level of MVPA, and what we found through the qualitative studies is that spending more time in the naturalized environment during childcare hours is also associated with a higher level of risk taking, because, for example, if you have a log of wood which is wet and then children want to balance around there, or loads of vegetation that is on the ground or very hilly and uneven surfaces. So there's much more risk associated with being outdoors and playing outdoors, which is great, but that might lead to children lowering their pace in terms of navigating through the outdoor space. And therefore we might observe, or in those studies, they might have observed lower MVPA levels, where there were higher affordances linking to more risk. And then I now pass over to Paul, who will speak a little bit about the quality of evidence that we found, because everything I just said, we should take a bit with a caveat.
Well, thanks, and I think perhaps this isn't certainly unique to this particular paper or this systematic review. This is just something you perhaps see quite a bit across all systematic reviews as well, in terms of the assessment of quality of the individual studies, and of course the certainty of the evidence at an outcome level. And I would say perhaps that's really important in the sense that we're of course wanting to use this evidence and work with perhaps decision makers and policy representatives to actually think, well, how best do we optimize the evidence base to assist you in your decision making process? So, you know, part of the papers here are really important for us to understand issues around causality and, you know, particular caveats around potential bias that exists maybe in the studies themselves. So we have to couch our kind of evidence when we speak to policymakers in that kind of framework, and at least allow them to understand where the evidence actually sits. So I think just very generically, fairly high level, you know, the assessment that we did was at both the individual level and at the outcome level. The individual studies tend to be fairly standard cross-sectional designs. Very few integrated a control condition as part of their actual experimental kind of setup. And that obviously has some substantial limitations in terms of our understanding of causality. Nobody used any form of randomization to condition as well. So that of course has particular problems with regards to the actual evidence and its use of evidence going forward. So, and I think one other particular issue around the actual individual studies was selection bias, perhaps also self-selecting into the studies themselves. Quite often we see in this particular field, certainly not this field or by any means, but certain people are interested in taking part in that particular type of research and are more likely to do so, which means that we can't perhaps generalize our research findings beyond perhaps that particular sample. So that seemed to be fairly prevalent, or at least to an extent, actually, it wasn't best reported in a lot of the studies. So a lot of the time, and it's certainly something we'll talk about in terms of kind of future directions, and it's something that's in the paper that we really want our authors, when we're writing this bit of work, to be as transparent and explicit about the full process as possible, because that's the only way we can understand about the quality of the actual evidence we have. But ultimately, that kind of meant at an outcome level, the kind of certainty of evidence as assessed by our grade tool, which is, you know, internationally recognized tool, was very low. And, you know, based on that, we should probably kind of couch and caveat the kind of way we use the particular evidence. That's not to say, though, the kind of grade tool in itself automatically downgrades evidence based on the study design, particularly randomization. So we didn't have anyone who in any of the studies included that did that. So you automatically get downgraded to low. But that just means, I think, that going forward, I think authors, and when they're conducting their studies, need to really think hard and kind of prospectively about how they can maximize the rigor and the robustness of their actual study design, because ultimately that's the only way we're going to advance the actual field. So I think that's super important, and it's something that we are trying our very best to do as we go forward in our journey in terms of trying to create a bit of evidence for the evidence base, is take this systematic review and go, okay, where are the weaknesses in our evidence base, and can we try our very best to kind of improve that? We obviously come up with barriers, and one of those is actually, is it possible, is it feasible to actually integrate some form of strong randomization into your study design? And it might not always be possible for a variety of different reasons. It's something that we actually have came across in the work we're doing as well. But there are other ways in which we can try and maximize the rigor of the design, and we should do our very best to integrate those into our future studies.
Great. Well, that's probably leads me directly into my last question, is really, what are your next steps? You know, where do you want to go from here?
Yeah, maybe I start with what we are already doing, and then Paul continues a bit more of what we would like to do and continue the work. So the institute that we are working in, we are very much, all our research is very much looking into taking a systems perspective on the work we are doing, mainly to reduce inequalities and promote health and well-being. And in terms of the work around early years and nature-based childcare, so what we did, we engaged with education practitioners, so on those that engage on the ground with the children, but also those that make decisions like on national and local government level. And we wanted to understand how they perceive the factors that help them implementing outdoor nature-based childcare in Scotland. So, and then we applied systems methods. So we did group model building and some network analysis and so on and so forth to identify, to create a map, a systems map, to and then to identify potential leverage factors that then can be targeted, ideally maybe through an intervention, whether it's a policy intervention or a research intervention, that then can hopefully have a ripple effect on the entire system. So we have just submitted a paper on that. And we're also interested, as part of being a systems piece of work, to look into how educators perceive the risks and the benefits of children playing outdoors and learning outdoors in nature, as well as parents, because of course there is no childcare without parents, right? So, and that is something we did through an online survey, and we are in the process of analyzing the data, and hopefully very soon something is coming out from that end as well. And yeah, I pass over to Paul. So talking about our evaluation work that we've started, so the pre-evaluation work that we started and where we want to go at, and the big question that is still out there that we really would like to tackle in the future.
Big question, plural, I think, perhaps, lots of them. I'd even just take, I'm going to take a step back as well and think about, from our unit perspective and the way we go about our research, and it'll be much the same as you and the viewers of this, is that we're trying to think through kind of a preventive model and approach to public health. So what can we do that has a population level impact, that has a life course model underpinning it as well? So that basically kind of sets our kind of framework for working with early years in a kind of education setting that has the potential to reach a whole population. And if we think that through from a population level health in terms of physical activity, it's clear that we can implement something that perhaps has that reach across whole populations, where all children of all backgrounds will have access, or the potential to have access. Certainly in Scotland, I've talked about the different delivery models and the policy initiative that exists at a Scottish perspective. It's where all children have access, regardless of background. So if we think about that from a prevention model in public health, we obviously want to try and instill those real positive behaviours at an early life course stage that hopefully instills kind of positive habits as we go through into adolescence and adulthood, where we'll get more positive experience with the outdoors, with nature, and in turn the health behaviours and health outcomes. So that kind of couches, I think, what we are trying to do with this particular bit of work. And it kind of, we all know of the kind of World Health Organization's Global Action Plan back in 2018. If we read that document, very, very much a systems-based approach to tackling these big problems. And part of that is thinking about creating active environments and creating active systems. And of course, we are trying to think through, well, how do we adapt that and adopt it, at a local level and at a national level? So we think with the wider rollout and implementation of at least outdoor nature-based ECE, we have an opportunity to have a little piece in that jigsaw puzzle. So ultimately, we are trying to think through what Anne said, and we've created that systems-based map to try and think about where all these components perhaps exist, and what does that mean for our future kind of research. And I mean, I can touch on a few just very briefly. One is very clearly a dose response particular issue with regards to this. It's something that we still don't know a tremendous amount from, and it's not something we're able to draw a lot from systematic review. And from a dose perspective, we're talking about, what could be the minimum time spent outdoors in nature for us to experience, or for children to experience any health benefit. But not only just time, but what does that outdoor space look like? What does that exposure look like in terms of the naturalized affordances? Is there a particular combination of affordances that are particularly useful to specific health outcomes? And that leads on to that aspect of, well, which health outcomes in terms of physical activity are we most likely to see the effects on? Anne mentioned briefly earlier on, we might not see it in MVPA, but we might see it in reduction in time spent sedentary. We might see it in increased time spent in total physical activity, or we might see it in other things like improved balance, agility, speed, grip strength, these particular kind of motor skills or motor competencies. And it very much speaks to the types of affordances and the types of exposure that the children are, and the variation, I suppose, that also exists with that. So that's a huge question that I think we are trying our very best to think through. And of course, inherent in all that is the idea of mechanisms and trying to think through what are the pathways and mechanisms that actually exist within that kind of evaluation framework. I think the last thing I just want to talk about very briefly is a lot of the research we have included in the review is short-term, it's very acute, and doesn't much go beyond 12 months. Do we know the actual long-term impacts or benefits of children who are exposed to or engaged with nature at the early years in terms of what their later life outcomes look like in terms of their physical activity? The answer, as far as we know, is no, we don't. And that's something we'd love to try and find out. And that obviously requires a lot of investment, a lot of resources, and a lot of time, but exceptionally valuable if we can get that bit of work. So can we use any retrospective data of longitudinal cohort, perhaps, that exists, where we can actually identify the exposure at that stage? We're trying our best to find it, coming up short just now. But if not, prospectively, can we think, is that something we can embed into future data collections? So that's probably where we're going next, to be honest.
Wonderful. Well, thank you both for your time today. This is really outstanding work. I think your paper is fantastic, and I encourage all of our listeners to check out the actual article on the JPA website. And so appreciate your time and have a great day. Thank you.
Thank you.
Thank you.